Good morning, I'm Steve Nauman. I'm a cardiologist. I work for WeCare. Today I want to talk to you about preventing cardiovascular disease. Now, cardiovascular disease is diseases which affect your heart, your brain, your legs, and basically there are 5 risk factors for cardiovascular disease that everybody should be aware of. Very simple. First one is genetics. Did your mother, father, or your brothers and sisters have heart disease at an early age? Now, that's not something you can do something about, but it's something you should be aware of when you go to your doctor. The second is smoking. Now, it's 2023. Everybody knows you shouldn't smoke. Everybody is trying to quit. And I just encourage you to keep working at it if you still smoke. The other 3, though, are high blood pressure, diabetes, and high cholesterol. Now, these are important because there's not something that's going to cause you symptoms. The only way you find out you have them is if you go to your doctor. And it's really important that we develop a habit of knowing these things and then going to our doctor and talking to them about those. Now let's go and do each one individually. First, high blood pressure. High blood pressure is so important, especially here in Northeast Florida. We're part of the South in our populations that are Black, Indigenous, and peoples of color. It's a very, very dangerous disease. It causes heart attacks and strokes, and it is underdiagnosed and undertreated. Now, when I say it's underdiagnosed, what I'm saying is people don't go to the doctor and get their blood pressure taken. And if they get it taken and it's high, the doctor may give them medicine. The doctor may say, change your diet, lose weight, blah, 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 blah. The most important thing, though, is going back to the doctor, getting your blood pressure rechecked. If you get medicine, take the medicine. You'd be amazed how many people take medicine, makes them feel bad. They don't take the medicine. They say, I don't want to go back to the doctor. He gave me something, made me sick. And then all of a sudden, something bad happens to you, and you've lost an opportunity to fix that. The other 2, diabetes and high cholesterol, once again, no symptoms. But if you go to the doctor, get a simple blood test, you can find out if you've got these things. There are ways to treat them that involve medication, dietary change. The important thing is going to the doctor and getting them diagnosed. And then the last question you should always ask your doctor after you see them is, when do you want me to come back? If they don't tell you that, then you need to push it, because these are not things there's not like a cough or a cold that's going to go away if you take some medicine. These are chronic illnesses that you have to stay on for the rest of your life. Preventative care is so important because it decreases the burden of having an illness later in your life. I mean, treating high blood pressure doesn't make you feel good, but it can prevent you from having a stroke 5-10 years later. It can prevent you from having a heart attack. The same is true for treatment for diabetes and high cholesterol and other things that cause cardiovascular disease. And also, going to the doctor is important for getting routine cancer screenings, which we don't do enough of in this part of the country. Well, very often, the first signs are different from men and women. Men, if you're developing a blockage in the artery of your heart, you may get chest tightness when you exercise, sometimes going in your left arm. Well, unfortunately, some of these diseases may be asymptomatic until something bad happens, which is why screening is so very, very important. I think men are deniers. That pain I had, it wasn't anything. It wasn't important. I got to go to work today. I'm busy. Last time I went to the doctor's office, he made me wait an hour. I don't have time for that in my life. Those are the kinds of things you hear all the time. But it's important for men to learn to listen to their bodies more. If you get something like short of breath when you walk upstairs that didn't happen a week ago, you think to yourself, is this something new that's going on? And if it is a persistent symptom, go to your doctor. I guess in one word, it's family. I want to be there for my family. I want to see my kids and grandkids grow up. If you go to the doctor and get screened for colon cancer and you can get taken care of, you're going to be there for your daughter's wedding, for your grandchildren. That's what's really important to me.